bust them down there at like 12 or 1 at night last night. One of the issues we're facing this morning is getting the people their medicine, because when they were evacuated, they have nothing. We have people at our stores right now buying underwear, t-shirts. There's a place there for them to shower. So we're gonna do our best to support them all day, and we'll see how this works out. We don't know what the long-term plans are, but we'll work, obviously, with the police and the fire. And I do have to say something about the fire last night. Spectacular work, trying to save lives and get this place under control, and the police making sure they maintained control, because it's a very chaotic scene, and these guys did a spectacular job in the face of a very bad tragedy.
Mayor Coogan, talk about your feelings. I can see you're
It's horrible. I mean, this is the kind of thing you don't want. Middle of July, Sunday night, and the city explodes around a tragedy like this. It's not good for anybody, but with the right people in place, you're able to maintain a level of control and a level of safety for all the residents. As you can see, this didn't spread anywhere. They kept it in that wing as best they could. It was more the smoke, as the chief pointed out, and these guys up and down the street did a great job last night.
And there are people who want to know, obviously how this started. The investigation is ongoing.
I'll go with his comments on that. We're not ready for that.
For family members who want some accountability, how this possibly happened, what do you say to them?
Yeah, so I would say that the investigators that are here are top notch, and that will work its way through the investigation.
Can you describe what those firefighters walked into? I know you had pointed out earlier this morning that it was the main entrance was really the engulfed part, but what did they see as they got through that building?
I think I can't speak to what they saw inside the building. When they pulled up, though, obviously our first priority is life safety. So when you pull up to a building, the first thing you see is the fire, but then you see the multiple people that are asking to be helped and begging to be helped out the windows. So that's where it complicates the scene and makes everything more difficult. So that is something that none of us want to ever pull up to. So, and unfortunately, like I said, that happened here last night, and we just pour our prayers out to the families of those who were hurt and killed.
And how are those 5 firefighters that were?
All right. Mayor Coogan and Fire Chief, can you guys tell us any updates that you might have this morning right now?
The updates I would have would relate to the building and the tenants. What we have is the owner's here. He's bringing down his crew. They're going to board the building up, secure it, then he'll deal with his insurance company and then whatever else he has to do. Our concern is the tenants that are in the Tomeo Center. We want to make sure they're placed in a safe, secure place that can handle their medical needs as quickly as possible. And we're also working on that, coordinating with his nursing staff.
Have you been able to determine how many people were here on the independent living side versus the assisted living side of things?
I don't have those numbers, sorry.
Can you talk about the ages of those who passed?
The ages of the residents?
That died.
Oh, I don't know the ages.
No, and we're still, like I said earlier, the notification process is still happening for that, so we're not able to release any of that.
No.
Is the owner being cooperative at this time?
Very cooperative. He knows he's responsible to take care of his residents, which is our main, as I said, our main concern. Granted, boarding up the building, we can handle that if he needed help with that, but at the same time, we want to make sure those people are taken care of. They had a good night last night at the Tomeo Center. I was down there this morning about 6:30. People were volunteering, bringing in food, muffins, McDonald's. Everybody got breakfast. With the cooperation of the fire department, we were able to get some nurses in the building to get the medicine, which obviously when people left, get out right now, they didn't take their medicine with them. So we're coordinating with that. We got their records out. So it's a lot of this kind of stuff you have to do to make sure people can live a full life and to the best of our ability.
Man, can you talk about concepts of the significance of this for Fall River?
This is very significant, but at the same time, it shows you what our public safety units are like. I mean, I was here last night till after 1, and it was a flood of police, firemen obviously in the building first. They were the ones that went in and made sure, that they could save as many of the residents as possible and get the fire out as quickly as possible. But it was a coordinated effort, because then the residents came across the street. They were in this parking lot, and EMS was attending to them while Jeff Bacon and his crew were going back in to try to find more. At the same time, the police had to close off the whole road, and you were here, a lot of passers-by coming in, and to coordinate safety and control to make sure that these guys can do their job the way they did, which was 5 stars. And at the same time, get the residents to a safe place.
What's the owner's name?
Significance. This is, I think, the second deadliest fire in Fall River history.
I don't really know the numbers, but again, this is a big fire. If it was one, it's one too many. So 10 is bordering on ridiculous.
Mayor Coogan, what's the owner's
Is there
name?
anything about an elevator? We've had some calls over the last couple of months about an elevator possibly working. Is there any? Can you tell me anything about an elevator in here or anything around?
I have nothing. I have no information about any
Would
elevators.
there-
I haven't heard anything about it.
Chief,
Were there
there's
any
no
obstacles
central
in the
AC,
building
so
to
a lot
getting
of
people out?
complain about the portable units. Was that an issue last night of all that AC?
I would say the issue with the ACs is that the windows that would have affected the best rescues have the ACs in them. So the rescues had to be done through the smaller windows, which are typically bathroom windows. So that's the only thing that I can say of any relevance right now as far as that. But I think it's important to note that I would venture to guess, without knowing the exact number, that there were more rescues out of this building last night than there have been in the 23 years that I've been a firefighter combined.
What number would that be?
I would say over half the residents had to be rescued either out the windows or down the hallways down the stairs by fire and police.
What is the owner's name?
Dennis. Don't know it, don't have it in front of me, but I do. I have met with him a few times before. He has other property in Fall River. He's down here right now making plans to take his responsibilities seriously for the building and especially for the tenants.
Do you know how long he's owned this building?
I do not.
What has he said about the fire? Was it staffed properly inside overnight, and was there an evacuation plan?
Way too early for that. I'm sorry.
Mayor, can you talk? I mean, was this place on your radar in terms of inspections, in terms of conditions?
All of our nursing homes are on our radar for inspections, and I know that the fire department and EMS is out here. They do have tenants that have frequent health issues, so we know this building. We know it well. And again, we work with the staff here and the management to try to make sure if they need help, we're here for them.
Beyond those window ACs, were there any other obstacles that you ran into in getting people out of the building?
I would just say the mobility issues associated with this type of facility is the biggest obstacle, right? I mean, you have a lot of people that can hardly get out of the building on a good day, right? So that's probably, and that type of a labor intensive operation is taxing to the biggest departments in the state. And so, I mean, 35 firefighters might seem like a lot, but when you think it takes 6 or 7 firefighters to get an average person out of a building safely, that puts into perspective how difficult it is and how time consuming it is and how physically exhausting it is to make those rescues.
Chief, you might have already answered it, but were there any oxygen tanks inside there?
There's several oxygen tanks, irrelevant to really the fire at this time.
When you say numbers, what was that number that you said rescues out? You know, ballpark on that?
I would say over 30.
There's 69 residents, so halfway.
And that's all, obviously, so the firefighters who worked last night left shift this morning. We had peer support teams go to all the stations to check in with them to make sure that they knew they were supported for what happened here last night. We'll continue that process, but part of that is the next shift they work. We will do a review. We'll have better numbers then, and I will absolutely make sure I update you guys with actual numbers and rescues and all that stuff.
Do you think the state fire marshal is pinpointing an area where they're looking at the cause of this?
Absolutely.
Give us a sense?
Absolutely. It's still under investigation, and like I've said a couple times, that an incident like this, we need to make sure that any information we release is the most accurate information possible. The worst thing we can do is release information before we're 100% sure, and that's going to take some time.
Were there working smoking detectors, and was there an evacuation plan for this building?
So per DPH, there is an evacuation plan, and we do we inspect this building. So without knowing, I would say that there is an evacuation plan, but I can't confirm that right now.
And for those 30 people that were transported to the hospital, how are they doing right now? Do you have any inklings on any injuries or the types of injuries that they're dealing with?
I do not. I'm sorry. So we still have 2 in critical condition. That's all I know. I don't know the status of the other victims.
The last time it was 1 in critical. Do we have 2 in critical this morning?
Okay, 1 in critical. Okay, I'm sorry.
One. That's
I misspoke.
okay. I just wanted to make sure.
1 in critical.
And we have that could obviously increase the fatalities here. We have official right now, is it 9 or 10?
9 is the official fatality count right now.
And you're in contact with all the families at this time?
Yeah. So through the city, through the state, we're making notifications and trying to help out the families as best we can.
The calls have been overwhelming of support from throughout the community. I'm going to stay on the best part of a very, very, very tragic situation. This city stepped up big time. Our public safety crew stepped up big time, whether it was fire, police, and I just want to stress that this was not anybody's plan on a Sunday night at the middle of July to come out here and tackle this, and they did a spectacular job in short work.
What are the next steps for this building?
The next steps of the building is to board it up. The owner has said he's going to leave someone on site because we don't want anybody coming in, looking for medicine, looking to see if there's any valuables left in the building. Once it's boarded up, he said he'll keep someone here, which is what we want. And then I'm very insistent that he heads down to the Tomeo Center and talk to his residents and make plans going forward for what he's going to do with those people, because we want them in a place where they're safe and secure, and through no fault of their own, we'll do whatever we can to help.
And for the people who were who survived this, who were rescued from this, they're at a shelter right now. Are they going to be there long term, or you know where they're going to be at?
That's going to be between the owner and the shelter's run by a friend of ours, Tom Mello. He does it for us in the winter, overflow shelter for homeless. He can hold 35, 40 people. So it was very, very good that we had that facility to get them down there right away. Showers, laundry. We have their medical staff going in and out already. The people I talked to that were down there were highly complimentary of how fast we got them a place to go last night, which is on 11 o'clock on a Sunday night for 30-something people. And the bus pulled up and got them down there. They were very pleased. And now we're going to do our follow-up work and make sure we have something more permanent for them.
Will this,
the Tomeo Center, TIMAO. It's right at the bottom of Kennedy Park.
will the city of Fall River financially support these people in any way?
We'll do whatever we have to do to help these people to the best of our ability.
Thank you so much, both of you. Thank you.
I think one other thing I would like to add is that the building will be secured. There'll be security here, and within an hour, all medications will be removed from this building. So I'd like to get that out there, that this building will be of no value to anybody within an hour or so.
Yep.
All right?
Thank you, guys.
Thank you. All right, as the gaggle of reporters clears out here, we have just spoken to the mayor of Fall River as well as the fire chief giving us an update this morning. We'll send it back to you now in the studio.
Abby and Gabriel, thank you. Something that I took away from this, Tammy, was folks there on a good day, quote, can hardly get out of the building because these are folks with mobility issues and otherwise. So just a tragic scene unfolding. We do want to also make note that a nursing home is separate from what this is. So this is independent living and assisted living. Independent living is basically you're there for convenience.
Right.
You're not dealing with a lot of maintenance stuff like in a house, but assisted living has to do more with you do need some care, 24/7 skilled medical care, at least a phone call or a beep away.
Yeah, so I have the National Institute on Aging pulled up here, and it says assisted living is for people who need help with daily care, but not as much as a nursing home. So this is not a nursing home. Correct. Like Allison just said, it's assisted living and independent care. An interesting thing is when they were talking about fighting the fire, those AC units. Obviously, the AC has been pumping across southern New England lately. However, you could see
it's been humid, yes, but not every facility can afford a full-fledged HVAC system being brought in too. So when you're looking at the pictures, you can see that they boarded up some of the parts, so it looks like they went in and around. I was also looking at the roof too. I didn't see a lot of openings up in the roof, so it didn't look like the fire was being fought from the top down. So we're going to keep an eye on all that as well. It does look like it's a 3-story building. They had about 35 firefighters arrive right there on the scene right away overnight, and then quickly, of course, other fire departments jumped in. Hospitals, not just St. Anne's, which is across the street, but also Rhode Island Hospital, Charlton, and St. Luke's in New Bedford, helping with some of the victims. There's a little bit of back and forth between how many in critical condition. We are back to 1 in critical condition, most likely for smoke inhalation. But yes, several other people, 9 people confirmed dead at this hour. And we're still learning that while they're boarding up that building, we're going to learn more. They did say that the medical examiner has not been able to take out all the bodies yet, unfortunately. This is just a devastating scene, and I understand Gabriel is now available to chat with us a little bit. Gabriel, I know you were trying to kind of pinpoint, you and Abby, who the owner is. The building, from what I can tell, has been licensed since 1999. What else are you hearing on the ground about who owns this? He is on site, correct?
Yeah, we have been told that the owner is here on site, and so Let me just grab this microphone here for a second. So we have been told the owner is here on site, and I do want to kind of give you a picture of what this building is like. So fire officials say this really was contained to this main center section of the building and the back of the building. The building is kind of a U shape here, and you can see towards the front on either end we have these almost fire escape porches where all of the doors are open, and stairs outside of the building where people are able to come out that way. But again, those are stairs, and a big issue we've been hearing about here is the mobility issue. So those ramps that come down, that is only from the center of the building, where you can see that is the worst part of this fire, was that middle of the building, and that is where all of these ramps out here actually connect to. So again, one of those challenging things we've seen. On the sides of the building, we can also see where there aren't those window ACs, all of those windows are open. We know firefighters on scene arrived to people sticking their heads out of the windows calling for help, and that those ACs did make it difficult for the firefighters on scene to actually get people out certain windows, because those ACs are put into the bigger windows, and those are the windows that make it easier to get people out. But I did want to give you that picture of this building. The main ramp that I'm seeing does lead up to this entrance where the worst fire damage can be seen. Fire officials did say that the fire damage was contained to one section of the building, but smoke was the other really big issue, even more than the fire. A lot of people treated for smoke inhalation. We know more than 30 people taken to the hospital, in addition to the 9 people that died in this fire overnight. 1 person remains in critical condition, and several firefighters were also treated on scene, and some taken to the hospital, but now released after dealing with this fire here.
Gabriel, it's interesting because when we were on the air this morning on Sunrise, it was much quieter. There weren't people going in and out as they are now. So from what you can tell behind you, the people who are coming in and out, they're boarding up the building. The fire chief was very clear, like, don't try and break in, because all the medicine and belongings, as best of their ability, is going to be taken out. Who else is up there? Does it look like some staff is coming back too? Can you tell?
Yeah, we definitely have seen some staff back here on scene. We know the owner is here. There's some police and fire officials, the mayor as well, but definitely some staff members. We saw one person come lay flowers right outside the sign that says Gabriel, House of Fall River. They put some flowers down, and very emotional for everybody who's coming to check out this scene. Fire officials did say that while not all of the medicine was able to be saved, the room where medical records and those prescriptions are, that was not touched, and they are getting those records out of the building. So that is going to help them as they are going to refill all of these prescriptions for the residents who have been taken to the Tomeo Center, a different facility that's about a half-mile away from here. So anyone who wasn't taken to the hospital, who didn't need to be treated, they are over at the Tomeo Center right now. And right now, fire officials are working to get all of those medical records out of the building. Any prescriptions they can save, but they don't want people coming here for that. They are going to handle that and get that to everyone as quickly as possible.
All right, Gabrielle, and we could see what appeared to be a staff person behind her, clearly emotional. You can imagine the toll this is taking on the families, the staff, everyone who is there.
The city has not seen something like this in quite some time.
Yeah,
thankfully.
absolutely devastating. Now, we are hearing from Massachusetts Governor Maura Healey. She has released a statement on this fire in Fall River. She says, quote, "The fire at Gabriel House in Fall River is a tragedy. My heart goes out to those who are waking up to the most horrific news unimaginable about their loved ones this morning. I'm grateful to the firefighters and first responders whose heroic efforts save lives. We are all praying." Again, we know that 30 people are in the hospital. 1 person is in critical condition at this time. This investigation, though, will continue for quite some time because there are so many unanswered questions.
Days, weeks. In fact, the governor confirming for us right now that a full investigation is already underway. I want to pull in NBC 10's Jean Valicenti right now. Jean, of course, you've been on the radio with us all morning. Just devastating. Listen, you and I have been covering southern New England now for many, many years, and I don't ever remember covering a fire of this magnitude in the city of Fall River, especially at a assisted living facility like this. Just devastating this morning.
No, I mean, maybe
What's
we'll have to go back in
takeaway?
the archives and see. I know there've been some fires where families were lost completely, but I had the mayor on this morning right after 6 o'clock, and I was hoping it wasn't going to be a number like this, but sure enough, he came out and said 9 dead, 1 critical, and more than 30 rushed to the hospital. Allison, you know, it's important to talk about, you mentioned this earlier, the difference between an assisted living and a nursing home. In many ways, had this been a nursing home fire, it could have been worse, because nursing home people, many of them are bedridden. and many of them are at the end of life stage, and it'd be almost impossible to start rolling beds out and people who can't walk. This is an assisted living. That means these people are ambulatory. In fact, to get into an assisted living, sometimes you have to pass a test. Can you walk up and down the steps? Can you walk on your own? Are you ambulatory? But still, in an assisted living, many people use walkers and many people use canes. Some are in a wheelchair, and you know, they're in their own rooms, and these were studio rooms. I took a look at it. These are mostly studio rooms, so one person, one bath, a little kitchenette setup. But the doors are closed at night, and in the rush of the chaos, they may be sleeping through this, and you have to bang on the door, or sometimes to open the door. Maybe the door is locked. You can't, it's just the worst scenario, just unfolded here with people who can't move fast, can't move quick. This was 3 stories. I don't know how many people on the 3rd floor, as we break it down, where are most of the lives lost? Was it 1st floor, 2nd floor, 3rd floor? But there's a lot to digest here, and it's important to note the difference between an assisted living and a nursing home. And some assisted livings actually do fire drills because they're worried about just a scenario like this. And on the application process, you have to testify. Are you ambulatory? Can you get in? Can you walk around? Just for situations like this. And assisted living is you're getting old, you're aging, but you're mobile. You can still care for yourself mostly. You need a little help with a shower. Or you're not cooking anymore, so you have communal meals downstairs in a big room. Everybody sits together, and there's activities. There's bingo and all kinds of things to do during the day. It's assisted living, exactly what it says. You need a little help, but you're not quite ready for a nursing home. That's the next stage. And socialization is important. You're with people who are in your same situation, things like that. So it's a shame that this happened, and I was just fearful that that number was going to be this high. It's terrible. 9 dead, 1 critical, and 30 transported. And now comes, where are we going to put these people? You know, that's another issue. Where are they going to go today? All kinds of issues to go. Back to you in the studio, Allison.
And what's also concerning too is staffing levels, right? At a nursing home, you have 24/7 staffing. Right. You know, you don't have that in independent supported living or assisted living either. So
the ratio is not the same by any means.
No, of course not. It's not staffed the same. It's not funded at the same level. Right. You know, there's affordable housing units too, and those often have required by cities, towns, states evacuation plans. But this is an entirely different setup at the same time.
And Jean mentioned, you know, going through fire drills because of things like this being the worst case scenario, them fearing things like this happening. The chief did say that the Department of Public Health in Massachusetts does require an evacuation plan. So one of the big questions is, what does that evacuation plan entail? Right. Was it in depth enough? And when was it last updated?
Was it practiced?
Yes, was it practiced?
Right.
That's
There's
a great
difference
question.
Between something up on the wall that was submitted and something that was actually practiced. Yes. Jean.
Al, can I just jump back in?
Yeah.
Can I just jump back in for a second? You know, I have relatives in assisted living, so I've gone through the whole process. I really know, unless you have someone who's gone through the process, then you learn. It's a learning experience. But, you know, when you talk about staffing levels, fully staffed during the day, all chefs and wait staff and clerks and administrators.
Night's a different story.
At night, though, after 8 o'clock, different story. You may have 1 or 2 nurses watching everybody because these are not critical patients. So you have 1 or 2 nurses, they're doing medication management. That's a big part of this. Right. They go room to room, make sure everybody's taking their meds. And then sometimes after 8 o'clock, there's nobody at the front desk. So you may have 2 people to watch over the whole complex. So can you imagine? This is a late night fire.
Right.
Reduced staff.
9:30.
Just maybe, I don't know how many people. We're going to find out how many people.
If
1
any,
or 2.
Jean.
That wouldn't be unusual.
Correct.
Yeah, Jean, that's a great point. My grandmother was in assisted living facility in Massachusetts a little over a decade ago, and you're right. Once 8 p.m. hits, the front desk does leave. Most people do leave. I think perhaps they had 1 person on staff, but for a very large assisted living facility, that was in Western Massachusetts. This, of course, here in Southern New England. But you have to imagine that they operate with comparable management and comparable staffing levels
and funding levels too.
Now,
private pay or Medicaid, it depends on and how it's built, the business model is built. Also, Jean, Dan Buckhead, our assistant news director, just brought in like kind of a history of some of the biggest fires in Fall River, and you know, mill fires is what we typically talk about in New England when it comes to the big fires. This was 5+ alarms. The Great Fire of 1843. We're going all the way back. up into the Chase Mills fire. So that was the biggest one, at least according to this record, most recently in 1999. And here we are in 2025, right? And Jean, just like you this morning, you know, when the news was coming in, we were hoping for the best, and that number unfortunately just kept going up. So our thoughts, of course, are with all the families, as we also, Tammy, you on I-Team too, try to figure out, dig into the files about what might have went wrong here. We also don't know, I didn't get a clear answer. I know Abby was trying about whether or not the smoke detectors were working. I know she tried to get that in. That's something we'll want to follow up on. But we did hear, now this is unusual for older buildings, they did have sprinklers. And I think he said they were working. Did he say that, the fire chief? Or he just confirmed that they were there?
They were there.
Okay, so that's something we're going to want to follow up on as well.
But that, we want to look into fire inspection reports.
Absolutely.
We want to look into staffing levels. We want to look into all of that stuff when it comes to figuring out what went wrong with this fire, because, you know, as Jean mentioned, the number of people affected, 30 people hospitalized, 9 people dead. 100
beds, right? So 100 units, studios, it sounds like, but only 70% full. I wonder why that is as well. So that'd be interesting to look at too.
Yeah.
I think we're going to go back out to the field.
Could just.
Yeah, go ahead, Jean.
You want me to just jump? Yeah, Alice, I've been reading about this. Gabriel House presents itself as an affordable alternative to higher-end assisted livings. So I'm looking at it, $1,800, $2,000 package. You pay with Social Security. They leave you $100 in the end. Now, you know, with assisted living, the sky's the limit.
Right.
You can spend 6, 7, 8,
Oh,
9, 12, 15. You know,
they're expensive.
Yeah, you could spend. Sky's the limit, and depending on the services, whether it's nonprofit or for-profit, is a different model. Many of these places are for-profit versus nonprofit. So there's so much to this. But just think, Allison, you know, these are older people. Again, many of them have walkers, canes, and they're slow to move. And I'd like to know, did the lights go out? I mean, just think about that. The noise of the alarms, the lights are out.
And did many of these folks
blinking,
have
it's
smartphones
chaotic.
with them? Did they know how to use them? Could they get to the phones quickly enough? Could they find them, right? All of this potentially in the dark. Yeah.
Yeah,
all right, well,
but I must say, a lot of assisted living facilities, they do think about this.
They do.
This is like foremost in mind, a fire. They are prepared. A lot of them are laid out so that egress is important. So it's important to say the industry knows about this. The industry thinks about this a lot. Having gone through this, I could tell you that many of them have a test. We can't admit you unless you can get out in the fire. You can get down the stairs on your own. Never mind the elevator. The elevator might go out.
Right,
so
and
it's not an ideal
but
situation.
none of that's been confirmed yet. We did interview
a
relative.
Yeah, a reporter asked about that, and the fire chief.
It did get fixed, but it took a while.
Yeah, the fire chief did not confirm that anything currently was wrong.
Right. It's interesting to know too, because adults with disabilities, for example, who might live in housing authorities or in affordable housing units, they get what's called SSI, and usually the majority of their SSI goes to pay for their housing, and then whatever's left over is left over. So let's go back out to the field to Gabrielle and to Abby, who I believe are standing by as they've been talking to people coming in and out. It's interesting to see how busy it is right there, who's coming in and out, and we're going to be learning more and more throughout the day. So I want to throw it back out into the city of Fall River, where Abby and Gabrielle, I believe, are standing by for us.
Yeah, we have actually just heard from the mayor that the governor is on her way down here to the scene. She's expected to get here in about an hour. That's from the mayor, who just said the governor is on her way here down to the scene. And behind us, we have the mayor, we have fire officials, police, the owner of the building, all here as they are kind of assessing the damage after this just devastating fire. 9 people dead. 1 person is in critical condition in the hospital right now. More than 30 people taken to the hospital.
And we did get the owner's name, Dennis Escorn. I did speak to him. He was not willing to go on camera to talk about it, but the mayor did say he is taking accountability for what happened here in this building. The building will be boarded up behind us. I think they're in that process right now. They're saying that they're taking out any medications, any sensitive materials that are in this house, so no one comes by and takes those things. We also do see a lot of people, a lot of workers here who do take care of the residents coming here and are very outwardly emotional seeing the scene here today and the aftermath of the deadly fire that occurred overnight.
And this is just down the block from St. Anne's Hospital. We actually heard from fire officials that some people were able to get themselves to the hospital without the help of firefighters because it is that close by. We know people were also transported to other hospitals around the area. If you did have a loved one who was here at the Gabriel house, it's independent and assisted living. There's a reunification center at the hospital. We also know that the residents who were not injured were taken to another facility, the Tomeo Center, that's about a half-mile away. So all of those residents who are not taken to the hospital are at the Tomeo Center right now in Fall River. There is a phone number that we have on our website that you can call if you are looking for information. Please only call that if you have a loved one who is here that you're trying to find out where they are and how to get in contact with them. We're told the process of notifying the families of those 9 people killed in this devastating fire is ongoing. So we don't have a lot of information right now about who those people were, how old they were, what parts of this building it was they were living in. This is a 3-floor building here, and we did note the ramp really only comes out of this main section behind us where the fire was at its worst, and we heard there were issues with people, just the mobility issues. It's a big thing for people living here with the independent and assisted living, and they do have both. We don't know the makeup of how many people were in the independent living part versus the assisted living part right now.
And the mayor does say that the city is going to do all it can to support these people, whether it be assist with housing at the Tomeo Center or elsewhere. The owner is also very much so responsible for where these people go, as well as perhaps some financial support for these folks. We know the Red Cross is also assisting at this time, and really just so much devastation. We're seeing people walking up, seeing this place, passing this place on their way to work every day, nurses from the hospital down the road walking out before work, trying to check out what had gone on, and really just feeling the feelings from this terrible, terrible situation.
Yeah, we did see one person earlier come leave flowers under the sign here at the building. There's been some people who worked here at the Gabriel house that have come by that are kind of looking, seeing what they've got, and we have seen they're starting to take out some of those medical records that we've been told were not impacted in the fire, and that's really important because a lot of the people who are living here have medications. They're on medication, and it's really important for them to get those prescriptions filled if their medication isn't able to be saved from the room. So firefighters are working on that right now, and then the building is going to be boarded up.
Yeah, absolutely. And so much more, like we said, to learn from this. The fire chief does say that there were codes concerns, so we are going to stay on top of this. We're going to ask all the questions that you at home probably have, and right now we'll send it back to you in the studio.
Abby, around, I want to say about 6:30 this morning when we were on the air with the Sunrise Show, you saw animal control coming by as well. What have you learned about that? I know there were some animals still in the building. Were they able to pull them out?
Yeah, so when animal control arrived, we saw them go in with a small-sized cage, and they actually came out not too long after that with a cat who was still living. I think that's a little silver lining here, that cat did survive. I'm not sure if any other animals did perish in this fire, but I did see the animal control worker walk out with that cat still alive.
Now, Abby and Gabrielle, I know that it's unclear right now how many people were living in assisted living versus the independent facility part of this building, but do we have any idea how that was separated? Typically, when you do see assisted living facilities and independent living under the same ownership, they're separated somehow, perhaps 2 different buildings, different floors, wings. Do we have any idea at this point?
No, right now we don't have that information. We've been asking questions about that, trying to learn how many people were in each, kind of how the building is situated. You can see behind us, this is a 3-story building. There are sections where we have these stairs outside of the building on either end. All of those doors are open at the moment, but the ramp only goes into that main center part of the building. We don't know who was living where, what part of this building was independent living versus assisted living, and we don't have a breakdown of how many people were living in independent living versus assisted living, though they did say a big theme throughout for the firefighters was mobility issues and it being very difficult to get people out of this building because they just had that limited mobility. Not sure if everybody, even if they were able to get to these stairs, was able to take the stairs on their own. You can actually kind of see, it looks like there's a wheelchair that was kind of left by one of the doors. Somebody likely carried down and out. And when firefighters arrived on the scene, a lot of people were sticking their heads out of these windows begging for help, but there's still a lot of questions about the makeup of this building, the makeup of the independent living versus assisted living part of this facility. Their website and the sign outside the building advertises both.
And we're also going to learn more about any issues with crowding when people were trying to escape as well, I'm sure. The building was licensed in 1999, from what I can tell. So we'll be learning about how that process keeps getting updated, recertified, if you will, year to year. So we'll be digging into all of that as well. Good to note, though, that the owner is on scene. And even though not wanting to comment to reporters right now, the fire chief said, and the mayor did confirm, that the owner, he is cooperating with them.
Yeah, and taking accountability and helping, with this investigation, because as we mentioned, this will be a full investigation. Governor Healy already said that she is on her way to that facility in Fall River. And we also know that they are closing down that facility, essentially. They're getting out the medications, they're locking everything up. That should happen around 10:15, right around the time that Governor Healy does arrive there. And I'm sure that she has plenty of questions for them on how something like this could happen. This, of course, a complete nightmare situation for a facility like this. Gene Valicenti mentioned earlier, they plan for this. They think of this as one of the worst case scenarios that could happen, but having it actually happen.
I was just going to say, there's a difference between a plan and a practice too, right, Gene? Now, you and I have been talking about this with parents who've been getting older, right, Gene? And we've been researching different places and practices. What surprises me is there's a wait list for so many places, and if they have 100 beds, they're saying there were only 70 residents at the time. That's kind of interesting to me, that we'll have to look into as well. But 1999 is when we understand it was licensed, 100 beds. I guess a little bit of a blessing this morning is that the fire didn't spread. The fire chief did say it was contained. But when you're looking at this building, Gene, what are you thinking? 3 stories, we see the ramp, questions about the elevator.
Yeah. I'm just thinking about the lights going out for some reason and how chaotic that could be in the middle of the night. And, I'm looking at the 3 categories of care they offer. They also, so independent, we talked about that, assisted living. It's not a nursing home. It's not a nursing home, but they also offer a category of care called a group adult foster care, which is a program in Massachusetts for younger people who may be cognitively impaired or in need of supervision. That's kind of a 3rd category of care. So there may have been some younger people in this building, part of this group foster care program in Massachusetts. Just people who can't live on their own, need a structured, supervised setting. So that's 3 categories of care that they talk about on their website. And again, they position themselves as an alternative to the higher end. And if you look at some of the prices, $1,800, $2,000, they'll take your Social Security and then you'll leave you $100 in your bank account. That's kind of the way it works. But you and I were talking, you could spend, the sky's the limit on this. So we're getting kind of a feel for what category they were serving. It's 3 floors. Who's up on the top floor, who's on the second, who's on the first, where's the dining facility. We're going to learn more about this. Now, I had the mayor on. Mayor Coogan was on early in the morning. He was there since 10 o'clock. He says he knows people in this facility, but that he hasn't really been inside. He's been on the porch. He said that, he had every firefighter in the city was called back, 50 at one point, 30 were called back off duty. There's so many questions
this morning
here.
On the radio with you, he didn't sound overly concerned. In other words, it wasn't like, oh yes, they've had a million violations that he had known about. He sounded genuinely surprised. He said it wasn't like a red flag for him when he heard about the facility.
Yeah, it's his city. He knows it pretty well.
Right.
I mean, if this place had been perennially troubled, I think he would have said that.
Exactly.
He didn't indicate that at all. He said he knows people there. Hasn't really been through it, but he didn't give that indication that this is a troubled place or anything like that.
Right, it didn't sound like they had been there a lot for violations, so.
Yeah. reporters are going to be poring over every record there is
now
on this place
rightfully
from
so,
now.
yeah.
Gene, what do you make of the situation with the air conditioning units in the windows? Firefighters did say that hampered their efforts in getting inside because this was not a facility with central air, and as you mentioned, this was billed as an affordable alternative to traditional assisted living facilities. So, what do you make of all of that?
Well, it's older structures, air conditioner in the window, tough for the firefighter to get in. You're right, but in Fall River and New Bedford, so many of those triple deckers have a setup like this, and many of the buildings have air conditioning. I don't know. I guess the firemen may comment on that. That central air might have been easier for them to get in and out. It's looks like an older building. 3 floors up and down. I don't know what the interior looks like. I'm assuming central areas, and I know there's always a central dining facility where people come down and sit at their table and they share their meals with their seat mates, and they're coming and going all day long. Assisted living, they want to keep you busy. There's all kinds of programs and things to do, and then movie night, and sometimes they bring entertainment in. There's book clubs and current events and things like that you can take part in or choose not to. And some of them, as far as I know, some of them lock their doors at night, others don't. Others keep the door open. I don't know what the setup here was, whether they had rules on doors being knocked, but I mean, I think we could imagine that it was certainly in the middle of the night. You've got a skeleton crew on.
Right.
It's not everybody's there. They'll be there in the morning, and so 1 or 2 people, or however many they had, running and banging on doors and trying to get people out. That's going to be part of the story, I think.
Oh,
yes.
absolutely.
And I can speak a little bit to shared living arrangements. In Rhode Island, at least, they call them SLAs, and that's usually set up and overseen by an independent third party, like a social service agency. And what they do is they essentially oversee a group of people who might live together, like 2 brothers, a brother and a sister, and there's incentives for an able-bodied person to help take care of a brother, a sister, a son, a daughter who may be disabled, and it's an alternative to a group home or a nursing home or something like that. I'm not as familiar with the laws in Massachusetts, but it sounds like that third tier you were talking about, Gene, might be some sort of adaptation of what we call in Rhode Island an SLA or shared living arrangement. So it's a way to kind of keep families together, build incentive, and take a little pressure off the system, if you will, for nursing and skilled care and independent support services too. So it'd be interesting to learn more about that.
Especially since we know these systems are so overwhelmed.
Yes.
I mean, we've reported
and a housing
on so many
crisis,
shortages.
right?
The housing crisis, there's the crisis within, I know this isn't a nursing home, but nursing homes with staffing shortages, with getting your spot. I mean, you and Gene were talking about the issues of finding even assisted living facilities that have space.
Not easy.
It's not easy at all.
Yeah. Not unusual, though, at the same time.
Now this.
Go ahead, Gene.
This, Allison, this particular program that they take part in, it's on their website, is the group adult foster care, and it's Medicaid funded in Massachusetts. Now, a lot of assisted livings don't take Medicaid. Many are private pay. Even the nonprofits and even the for-profits, it's private pay. And when you run out of money, you're going to have to figure out what to do. And nursing homes, some of them have Medicaid beds set aside. But this one, it positions itself as an affordable alternative to the higher-end homes. They accepted Medicaid group-funded adult foster care. That could be younger people, not necessarily older people. In addition, in addition to the regular assisted living and independent living. Now, when they say independent living, Allison, it's you're not completely independent. It's not like you're living in an apartment house. You're there to have people around you. You may need a little help with something before you graduate into the full assisted living. So you're there for a reason, because you need assistance at this point in your life.
Right. And it's skilled assistance, but not necessarily 24/7 or overnight, which is the big distinguishing point for sure. Governor Healy is supposed to be there within, I would say at this point, within the next half hour. So we're going to stay on the air until about 10 o'clock in the morning and then come back when she arrives there as well. This also hit the Today Show this morning as well. So this is becoming a national story too, because we haven't seen something like this in such a long period of time. It's just heartbreaking for these families who are also, imagine their position. They're getting a phone call late at night and trying to find people and figure out if their loved ones are safe or not. So we're also going to hopefully have a crew at St. Anne's too, where people are trying to make some to identify one another and also lean on one another too during this time.
Yeah, I think it's so important to emphasize just the overall tragedy that this is for so many people. I mean, like you said, to get that phone call is devastating. When you hear the story, your stomach drops.
Right, and it was a hot night. The air conditioners were probably on in all those units. Not an unusual scene in southern New England, in urban centers, to have those ACs in the window and pumping. And then the question we'll need to learn as we dive deeper into the morning is, we understand there were sprinklers in the building. Were they working? Smoke detectors, were they working?
Were they all working?
Right,
you know, if some are working and others aren't, that's still
We're
problematic.
going to have to figure all that out. We have 9 people, though, confirmed dead this morning, 1 in critical condition, 5 firefighters injured, but their recoveries are supposed to be non-life-threatening. The mayor praising all the rescue crews, first responders who came this morning. It was all hands on deck, of course, not just from the city of Fall River, but from surrounding areas as well. And we should mention St. Anne's is across the street, but St. Anne's also couldn't get to everybody. So Rhode Island Hospital here in Providence, their trauma unit responding, in addition to Charlton and St. Luke's in New Bedford. We're going to pop on out to Gabriel again, who's been talking to people on the ground. And Gabriel, what are you learning now? Who's behind you? Fire chief obviously still on the scene. Have you seen many family members, or does it look like they're mostly going to St. Anne's as directed to that assistance center there? What can you tell us?
Yeah, we haven't seen many family members. We've seen a couple workers coming here to the scene. The mayor, the fire chief, and the owner have also been here at the scene. Obviously, a lot of reporters here working to figure out exactly what went wrong leading up to this just absolute tragedy where 9 people are dead. Now, St. Anne's Hospital, I want to give you an idea, is really just down the street. So if you just walk just about a block this way, there is a parking lot, and then we're at Main Street with St. Anne's Hospital. It is right there. We don't really see people there. It's hard to tell if people are inside at that reunification center in the chapel over at St. Anne's. There's also that phone number for people to call. And then for people who were living here, who were not injured, who were able to safely get out, they are over at the Tomeo Center right now. So I think we have a crew on their way over to the Tomeo Center. I'm not sure if any family has been over there reuniting with those loved ones who were able to make it out okay. But we haven't seen many family members actually showing up here to the scene, looking at this fire. It has mostly been workers, employees, and a lot of firefighters, police, mayor's office, and of course the fire chief is here. We know the governor is on her way. Should probably be here around 10:15, 10:20 was the original estimate that we got. She was about an hour away when we learned that she was coming here. But right now it's just a devastating scene. The street here has reopened. This was closed for most of the morning, so people are able to get in and out. This is Oliver Street, so we are just down the block from St. Anne's Hospital, which is on South Main Street. So Oliver Street now is back open, and there are different apartments kind of in the opposite direction of the hospital on this street. And so we're here kind of working to learn more about what's actually going on. At this point, we've seen some crews. Looks like they're getting ready to start boarding up this building in the wake of this just absolutely devastating fire.
And Gabby, they're going to start boarding up that building pretty soon, is my understanding, because they want to make sure it's secure in the neighborhood as well. They were able to save all the medical records, and they got most of the medication out, so people will be able to get what they need.
And we do want to emphasize that phone number if, God forbid, you're waking up and you have a family member, a friend staying at that facility. That phone number is 508-674-5741. The reunification center is at St. Anne's, and there's also the Tomeo Center where other people are involved. So if you call that number, that's where you will find out where your loved one is if you're waking up to this devastating, heartbreaking news.
And at St. Anne's, they're being directed to the emergency room, the department right there, and also to the chapel on site as well. So this has been a very sad morning. The fire started around a little after 9:30 last night. And then we're learning more as we get deeper into the morning. It'll be interesting. I'm curious to hear from the governor about how the state will be able to help the city with financial resources, of course, for the residents who've been affected. We do know the Red Cross is on scene, as Gabrielle and Abby have been telling us. There's that phone number for you again, so you can see it and share it. 508-674-5741. 41. It's actually good to know that family members aren't swarming on the location there
Right.
so that they can take care of the investigation, which I'm guessing will take weeks, if not months. So, Jean, gosh, okay, we're getting a tighter shot right here of the building right now.
That's
You can
where they
see
said that fire was contained.
right where it started. They said it didn't spread. It seemed to be contained, at least the flames, mostly
Right.
to that section. And what they were really dealing with was smoke inhalation as it was billowing through the building. But there you can see that looks like two different entrances to the front, handicap ramp, kind of retrofitted to the front of the building too, to the side of the stairs. I'm curious to know how old this building is. You know, it's New England
does look
stock,
pretty old.
right? So to keep it licensed, what do they have to do? Are these air conditioners installed correctly? That's something I think a lot of us will look into as well. But at the same time, not unusual to
Yeah.
see window units in a building of this age.
To me, though, I will say it's unusual to see window units in an assisted living facility.
It depends on how old it is and how big it is, and funding. Yeah.
Yeah.
So that'll all be part of the investigation.
All right, we have Jean Valicenti here with us too. And Jean, you've been reporting on this all morning long.
Yeah, Allison and Tammy, you know, maybe something good will come of this. Maybe assisted livings and nursing homes are going to hold more frequent fire drills. Maybe some of them today will be just tightening everything up just because, you know, they just want to do that. And, you know, I haven't heard of any other assisted living fires.
I
So
haven't
it's not like this
either.
is something that is plaguing the industry. I really haven't. I know they do fire drills. I know this is top of mind. The ones that I've been in have fire suppressant systems and all kinds of alarms in the rooms, out of the rooms. But I guess you could always redouble your efforts and just have a fire drill today so that make sure that everybody can still get down the stairs. That was a big thing having gone through this. You have to pass the test. You have to be able to get up and down the stairs because if you're up on the second floor, you can't rely on the elevator. But, you know, I just from personal experience, it takes a while sometimes for an older person to get ready. You just can't rush them. So can you imagine? Hurry up, get out, get out, get out.
Yeah.
That's physically impossible sometimes.
And Jean, like
even
you
under
said,
the
with
best
no
of
lights.
circumstances.
Right.
With no lights and things blinking and screaming and
And chaos
really
and
the worst
stress,
scenario here.
right?
Yeah.
All of it
Chaos,
happening
yeah.
so quickly.
Yep.
And if the
And
fire
then we
was
know that some people were
contained
hanging out.
to that one area, you do
We know
wonder
some people-
too if people questioned, you know, how serious is this? Do we need to get out right now? Can I grab my things first?
Right, right, and how much you want to pull things out. Also, you know, typically fire extinguishers are checked on an annual basis when it comes to owning commercial real estate. You always check on that. Sprinkler, fire alarm, quarterly. When you own a building of this size, you're required to do these quarterly and annual inspections. So I'm sure we'll be looking into this. Was good to hear, though, that the building had sprinklers in it. So I
Yeah.
wasn't quite sure when this was unfolding this morning because of the potential age of this building. But we're going to be learning a lot. And like you said, Jean, we'll be learning, too, if maybe some fire codes need to be adjusted, evacuation codes, best practices, if you will, when it comes to the industry. But yes, that is absolutely true. We don't hear about something like this too often, thankfully. So hopefully we can learn from it, too. I do want to stress that the fire chief seemed very pleased with the response. Everybody jumping into action, not just from the city of Fall River, but from all over. It was all hands on deck, of course. This was a big fire for them to fight, and everybody, he said, quote, was rescuing people, essentially. So we're going to take it from there. We're waiting for the governor to arrive on the scene, and she did release this statement out on X, which says, in part, Tammy, I'll start, you can finish. The fire at Gabriel House in Fall River, she says, is a tragedy. My heart goes out to those who are waking up to the most horrific news imaginable about their loved ones this morning.
I'm grateful to the firefighters and first responders whose heroic efforts saved lives. We are all praying. She also goes on to say that there is a full investigation into this fire. And again, she's on her way there. She's expressing her condolences to everybody affected by this fire. So she should be in Fall River, we think, within the next 20, 30 minutes
Probably,
or so.
yeah, she's usually right on time, right? So she was, like us,
Yeah.
waking up to this morning,
Yeah.
too. I mean, we knew the fire started last night, but then things escalated as we got deeper into the evening.
Yeah.
So some animals being rescued, I suppose a small silver lining. The fire investigation now has started. This will take days, weeks, potentially months. This building, it was licensed as a facility for independent and assisted living. 1999 100 units or beds in this facility. We understand that it was about 70% full at the time, 70 people living there. This is unusual from what I can tell in my research this morning. We haven't seen a fire like this ever, really, let alone a mill fire was kind of a significant one, the Chase Mills fire back in 1999. So the fire department was really put to the test here. We do understand sprinklers were there. We're trying to learn if they were working at the time. And people are being reunited, hopefully, with as many family members as possible over at St. Anne's Hospital. 30 people taken to the hospital, one still listed in critical condition. Of the 55 plus firefighters who responded to the scene, we know 5 did report having some minor injuries, but are expected to make full recoveries.
Governor Maura Healey on her way to the scene in Fall River right now. We will also be bringing you that live right here on NBC 10. We have reporters there on the scene. We will have continuing coverage on this horrific tragedy throughout the day. You can find that on our website at turnto10.com. We also have a lot of coverage on our YouTube channel, and you can subscribe to our mobile app as well to get any notifications about this. There is a phone number if you are a family member of somebody who lived there. That's 508-674-5741.
That street is now shut down. The building is being boarded up. We'll have more from Governor Healey coming up in about 10 or 15 minutes or so. Reporting, though, now live, I'm Allison Bologna.
I'm Tamara Sakarzik.